The hospital hallways are too quiet for a Friday night. You're a third-year surgical resident, and tonight is your first solo emergency procedure, an exploratory laparotomy. The attending on call, Dr. Hanley, was called away on a trauma across town. He left you in charge temporarily until a relief surgeon arrives. Just stabilize the patient. Don't do anything too ambitious, he said, patting your shoulder before vanishing behind swinging doors. Now you're standing in OR3, staring down at the open abdomen of a 26-year-old woman who came in with acute abdominal pain and internal bleeding from an unknown source. Her name is Angela Torres. She's hypotensive, losing blood faster than the nurses can replenish it, and the suction canister already looks like a crime scene. You thought this would be straightforward, a bleeding ulcer maybe, but her anatomy is not cooperating. Her liver is swollen, pulsing, and there's free blood pooling from somewhere deep behind the bowel. The resident assisting you, Davis, looks at you with wide eyes over his mask. BP dropping, 80/40, the anesthesiologist calls out. You sweep a hand across your forehead, sweat beads beneath your surgical cap. The source of the bleed must be vascular, possibly the inferior mesenteric artery, maybe a splenic laceration you missed. But here's the real problem. You've retracted the intestines to access the posterior cavity, and in the process you've noticed something strange. Scar tissue. Lots of it, and a foreign object embedded near the aorta. Metal. What the hell? Davis mutters, leaning in. You both stare. It's an old surgical clip. No, not one. Three. Someone's been here before. You feel your stomach clench. This wasn't in her medical records. Doctor, she's crashing, the anesthesiologist barks. We're going to lose her. You're seconds from clamping near the artery when Davis murmurs, "There's no surgical record of this. Who hides a vascular repair?" And that's when the second thing happens. A surgical nurse, Lisa, taps your shoulder and whispers in your ear. There's someone outside the OR, says he's with Homeland Security, wants to speak with the lead surgeon immediately. You stare at her. Now? She nods. He says it's urgent. Something about the patient. Tell him I'm in the middle of an operation, you snap, trying to keep your hands steady. Lisa hesitates. He said, quote, "You need to stop what you're doing. You don't know who she is." The room tilts. The monitors are screaming now. Angela's BP is 70/30. The bleeding won't stop. You have less than 2 minutes before irreversible organ damage. You can clamp now and risk damaging something vital, or you can wait and try to get that bleeding under control another way. Or you can step away for 60 seconds and hear what this agent has to say, risking the patient's life to understand what you're really involved in. Davis leans in close. What's it gonna be, Doc? And that's when the lights flicker. Just for a second. You glance at the anesthesiologist, who shrugs with wide eyes. The generator should be keeping things stable, but now the monitors are glitching, flickering between numbers and static. The ventilator's pressure readings jump. You hear something pop behind the wall, electrical, sharp, ominous. Did we just get hacked? Davis asks under his breath. You don't answer. You're too busy noticing what's just shifted in the surgical field. One of the foreign clips has something embedded in it, something you didn't see before. No, not a clip. It's not surgical metal at all. It's rounded, metallic black with tiny grooves. It's a sensor or a transmitter, a device. Angela Torres wasn't just hiding a past surgery. Like someone implanted this inside her. You don't know what it is, but it's not medical-grade hardware. Suddenly, the door to the OR slams open. Everyone turns as a man in a dark windbreaker storms in, flashing a badge. He doesn't wait for permission. "Dr. Keene," he says, locking eyes with you. "Step away from the patient." The scrub nurse instinctively moves to block him, but he's already halfway to the table. The air is thick with adrenaline. The smell of blood and ozone clings to your skin. "You can't be in here," you shout, hands still deep in Angela's open body. "Listen to me," he says. "Her name is not Angela Torres. Her real name is classified. That device inside her has a biometric trigger. If her blood pressure drops below a certain point, or if someone tries to remove it the wrong way, it will activate." "Activate what?" Davis asks, voice sharp. The agent doesn't blink. "A failsafe. There's a chemical payload attached to the device. If it disperses, everyone in this room dies. Possibly everyone in the hospital." No one speaks. The beeping of the monitors becomes a countdown. Angela's pressure is dropping. She's bleeding out fast. You realize the pool of blood near the device is heating slightly. A low hiss rises from somewhere inside her. Whatever you're going to do, the agent says, don't touch that device again. Clamp the vessel manually. Seal the cavity. Get her stable, then step away. You stare down into her, heartbeat pounding in your skull. This isn't surgery anymore. It's a bomb defusal with a human heart beating beneath your fingers. You can't look anything up. You can't phone a specialist. You can't even ask for help. You're flying blind with nothing but instinct, shaky training, and adrenaline. The device in her abdomen hums faintly. It wasn't doing that before. The nurse next to you whispers, "What is this?" You ignore her. Focus. You're losing her. You know you can clamp a major vessel above the device, cut blood loss long enough to stabilize her. But one wrong move, one jolt, and that tiny black object might decide you've crossed a line. Everyone in the OR is frozen, watching you. You, hands deep in a stranger's secrets. What do you do?